Hi guys, so today we're going to talk about being a type 1 diabetic and using horseback riding as a form of therapy or maintenance for your type 1 diabetes. So always your doctors, when you are diagnosed with type 1 diabetes, and I've almost had it for 40 years now, one of the first things my doctor said was exercise is essential. Why is exercise essential? Well, as an exercise physiologist, now it's the equine exercise physiologist, but horse or human, we need energy to produce our activity. Whether we're riding, walking our dog, whatnot, we need energy. And energy comes in the form of what we eat. So your body breaks down those sugars out of our carbs that we eat, whatnot, and then we get glucose. Glucose is stored in our muscles. And also in our liver, but when we start to exercise and exercise those muscles, then our body pulls out that storage and utilizes it, okay? Now, if we eat a lot and then we don't use those muscles and exercise, then we've got a lot of extra sugars in our body. And that not only within our muscles, but mostly circulating around our body, because there's nowhere really to store it. It's just circulating around. And that's when our blood sugars go up. High blood sugars are bad. They can cause things like diabetic retinopathy, diabetic neuropathy, all kinds of related issues. So exercise is essential no matter what. Now, early on, my mom, when I was diagnosed, was told, as a diabetic, two really excellent forms of exercise is horseback riding and riding. One of the things why is because, as you notice, my legs are off of the ground. So if you have diabetic pain in your legs, also, if you're causing a lot of wear and tear in your legs, you may have open sores. That's not good for a diabetic. So again, this prevents, just like swimming, prevents me from really putting wear and tear on my legs. On the flip side, we need to get those legs moving, okay? A lot of times we see poor circulation in diabetics, especially as we age like me, in our lower legs. One of the worst things for me is sitting in an airplane for a long period. So circulation is essential, and encouraging that through exercise is great. So when we're riding, and as you see, I'm in an English saddle, one of the great things, I can really feel the horse. I love either riding an English saddle or also riding bareback, because I can feel the horse, the warmth of me working against it, actually against that horse, and the warmth from the horse's body actually helps to improve that circulation in my lower legs. I just had my checkup with my diabetic foot specialist, and again, she came back and said, I can't believe you've had diabetes almost for 40 years. Your feet are doing great. Your circulation, your feelings within your feet are doing great. And that really, I attribute that to horseback riding. So again, it helps with that circulation and helps to keep it going. Now, one of the biggest muscles we use in exercising in humans is our thigh muscles. Really, literally anything we do will help to get those thigh muscle moving. And it's going to be the biggest impact on kind of our blood sugars, because the more we work those thigh muscles, the more it's going to be using those sugars for it to work, okay? So again, exercises where we're using that thigh muscle is excellent for that. So again, riding, staying stabilized. Also an English saddle will do what we call a posting trot. And again, I'm really working that thigh muscle. I may go up into a 2-point, like a jumping position. I'm really working that thigh muscle to stay stabilized. So again, that's really going to help contribute to, utilizing those sugars. So exercise is great for that. Now watch, if you're first starting exercise, you always want to start with talking to your doctor, because again, if you haven't done exercise, you're going to find that you're going to have some changes as you exercise. First thing, when you first start exercising, especially on a horse, you might get excited, so the stress hormones, that adrenaline will start pumping. That'll actually cause your blood sugars to increase. So you say, isn't exercise supposed to help to decrease it? Honestly, your first couple of times as you start going, your body, you may see an increase in blood sugars, okay? At least while you're riding. And then after you get done, you may all of a sudden see this drop, because your body's trying to rebuild that storage of glucose within your muscles. That drop may last for 24 hours. So again, you really have got to monitor, particularly when you first get started. I'll show you on me, I have a monitoring system right here on my belly, and I have my monitor right here. So it constantly is checking my blood sugars while I'm riding. And it actually beeps if I get too high or too low. That is excellent for as you are going and actively exercising to monitor and keep monitoring that. So again, that's very important to make sure you don't get too low or too high. The other thing while I'm riding, I also have in my other pocket some quick sugar. So, you know, you never really know how your body's going to respond to a certain type of sugar. So, or a certain type of activity. So, you know, a sudden drop, you better be prepared when you're out in the arena. And so I have my quick sugar here in case it drops, okay? The other thing you like to do and want to make sure is that you hydrate properly. Really low hydration, and you're also sweating a lot, can really mess up your blood sugars, your level of your blood sugars. And so again, if you're not used to exercise, you may not realize how much you know, sweat you may produce and how much water you may lose. So hydration is essential. So you always want to make sure you hydrate, take breaks in between, just to make sure that you are staying hydrated. That's important. So if you're working in like an equine assisted activities and therapy program and you have a client that has a type 1 diabetes or even type 2, you want to make sure that they're hydrated. You check their blood sugars. If they don't have the continuous monitor, you know, check their blood sugars before they get started. Take a break, check it in a little, especially when they're first starting to ride, okay? Probably a big false would be a false positive. If my blood sugars get high, I usually get real thirsty. And so if I'm already dehydrated, I may think my blood sugars are higher than they really are. So again, hydration is essential. And that's going to help with circulation. Circulation is so important. Exercising helps with heart-related issues, whatnot, okay? Another benefit, so as I've gotten older, one of the issues I've dealt with is diabetic neuropathy, or diabetic retinopathy, and then diabetic neuropathy. With retinopathy, again, that affects my vision. With diabetic neuropathy, that affects my feeling. And so one of the things that I'll start to lose is balance. So again, I go back to, I love my hunt seat saddle because it forces me, it already kind of pushes me forward, so it forces me to stay balanced. It's not a big saddle like a Western saddle, so it keeps me where I have to check my balance. That's great for someone that has vision related issues and also lack of feeling elsewise, okay? So that's something too that I love about that. Going back to that posting trot where you're going up and down with that diagonal, great exercise. Again, because it's challenging my balance. So for my vision, that's something. And also for making me really use my feet and my legs, and I've got a lot of wiggle room there, so I have to really focus on that. Great form for those particular conditions, or at least that I've seen personally myself, and then those diabetics that I've worked with too in riding programs. The other thing, 2-point position, even practicing jumping, really challenges that balance. So again, as I've lost my vision very much in my left eye. And so again, I've got to really watch that I don't get off-sided. Challenge me as I'm coming up to a fence to really be able to stay balanced is really helpful, okay? And same thing with my neuropathy. Now I do have to watch when my neuropathy is really flaring up. It can get extremely painful. So again, this may not be, if you're really sensitive, that may be what we call a contraindication where you may not be able to ride that day. Same thing if your blood sugars are really high. Last thing you could work on, like working without stirrups, because again, that really challenges your balance. You get to also your gripping so you can feel the horse underneath you. Now, of course, you need a horse that not only is a big horse, you can see Val here is a big horse, so she helps with my balance. She's not real narrow. She's also, if you notice, she's kind of dead-sided here. So again, as I'm kind of gripping, it's not really bothering her. So I can really work on my legs and whatnot. But I can really feel the horse by wrapping it around. And I don't have to be scared because I've got a good horse that even if I grip really hard, not realizing I'm doing it because of my neuropathy, she's not really going anywhere. So she's nice and wide so I don't feel off even. And I can practice my 2-point without stirrups. I can practice even posting without stirrups. I can even do some leg exercises, stretching and whatnot. And with the wonderful thing about horseback riding is, as a type 1 diabetic, I want to work on that aerobic type of exercise, working on my heart rate and whatnot, because that is something we deal with diabetes, is heart-related issues. So again, the circulation, even in our lower legs, is essential. Strength building, so again, we want to work on building up our strength, particularly as we start to lose balance in certain area. And so that's really essential too. And then finally, flexibility, because again, if we're not moving and not staying flexible, we can start to see over time some joint related issues, and again, circulation related issues, whatnot. So the strength building, the flexibility, so I'm moving my legs, I'm flexible through my hips because I've got to be on this wide horse. And then the strength, I'm using the strength to pull myself out of the saddle. So these are all great. Horseback riding is one of those things where you can do all three of those within one. So that's what I've found, is that with my diabetes, this has been one of the best things that I can do for my diabetes. But again, the biggest thing is you want to start with your doctor, talk about the activities, then get with someone that is familiar, get with an equine assisted activities and therapy program that's familiar with diabetes, particularly type 1. That's probably one of my biggest hangups. Is a lot of times people think type 1 is exactly the same as type 2. It's not. There's some similarities, but again, there's a lot more involved with the type 1, particularly if you've had an adult that's had it since they were a child. So you do want to communicate with someone that is familiar, but always consult with your doctor first and then go from there. But again, exercise is great for my diabetes, and so that is something too that I highly encourage. And I found that the horseback riding, at least for me and what my doctor has found, has been excellent for you. But always, again, consult with your doctor first.